We had a wonderful gala on November 10th, and on the 11th, which is our Founders Day, November 11th, 1864, when this college was founded. And we had a tremendous convocation on that day. Hundreds of alumni, faculty, staff, students were there and joined us in these wonderful celebrations. I want to show you just a very quick video recap of what a wonderful time that was. Welcome, all of you. Welcome to this historic occasion as St. Louis College of Pharmacy celebrates our 150th birthday, our sesquicentennial.
150 years ago tomorrow, a group of visionary St. Louisans began forming the foundation of this great college, and for generations, men and women, faculty, staff, students, alumni, and trustees have worked together to create this special place. We must recognize that it's on their shoulders that we stand tonight. And it's because of their efforts that the St. Louis College of Pharmacy endures as a strong and vibrant institution.
And we're all here having a wonderful meal and a celebration, largely because of the vision of a few people.
When I think of St. Louis College of Pharmacy, I think of pride, opportunity, collaboration, and excellence. I am proud to call St. Louis College of Pharmacy my college, and soon I will be proud to call it my alma mater. This college will always be a big part of me, and I'm excited to be in the next chapter of its history. So on behalf of the students, happy 150th anniversary to our college.
I know that I speak for my fellow trustees when I say that we can't wait to get started on the next 150 years.
Together, we are the future of St. Louis College of Pharmacy. Today, we are building on our historic strengths as we enter, as Jane Arnold said, the chairman of our board, our next 150 years. We're undergoing, obviously, an unbelievable physical transformation, as you can see right out this window. Our campus construction is going full tilt. And what you're looking at here is only phase one of a three-phase project that we have going. Phase one, our newest building, our academic and research building, it's a 213,000 square foot facility, 6 stories as the main part of the building, and a 4-level library that will be the home of our School of Pharmacy and the last 4 years of our curriculum. This building is amazing. It includes 92 offices, 53 student work areas, 5 teaching laboratories, 30,000 square feet of research space, a 33,000 square foot library, a 400-seat auditorium, 2 250-seat classrooms, 300-seat classrooms, 10 30-seat classrooms, 7 conference rooms, 10 group study rooms, a welcome center, a balcony in the auditorium, an outdoor reception space on the 3rd floor, study spaces for our students open 24 hours a day, 7 days a week. It's an amazing, amazing place. Had you been here another few weeks later, we would be having this event in this building. We are taking possession of the building in what's called the date of substantial completion on June 1, which you can tell from the calendar is about 10 or 11 days from now. That's not the date that it's going to be fully furnished and ready. That date of substantial completion is a legal term. It's the day we get the keys, the day we start paying for the utilities, and the day we start paying for the insurance on the building. It's not the day that we're up and rolling. On the 1st of June, within an hour of 6 a.m. of getting the keys. At 7 a.m., the first furniture delivery truck rolls into the dock of this new building. And for the next 6 weeks, we will be unloading and assembling furniture in this building. For 6 weeks it's going to take to do the AV and IT, the furniture installation, so that on or about the 15th of July, this building is going to be fully inhabitable, the building will be balanced, and our faculty will begin moving into the building. We're going to have what I'm calling a soft opening, a soft grand opening, probably the weekend before classes start on the 17th of August. And then a more formal public grand opening sometime in September. So it's going to be an exciting time this fall, and we're going to be ready to go. This building is a transformational building. I was in it last week. Dean Canaday, whose offices will be there, has been in it. I'm going in it again tomorrow morning. So I'm seeing this progress on a daily basis. But we're soon going to be able to all enjoy this incredible facility. Once this phase 1 is completed, we are going to quickly begin a second phase to build a second structure of the same size as this building. So we're only halfway there. A second building will include a complete center for our students. It's going to be a second residence hall, a new dining and kitchen facility, a student center, recreation center, gymnasium. It's going to be the kind of place that we have owed our students all along. And for the first time, they're going to get it. We're going to be breaking ground on this second phase in September. We think it's going to be a 13 to 14-month construction process. We hope to have the second phase completed by November-ish of 2016. We're finalizing the floor plans and the financing for this facility this week. But all signs are go that we're on track to begin construction of this building. In fact, your first sign will be on or about the 15th of June, a month from now, we'll begin deconstructing Welpley Hall. And that's going to come down over the course of about 3 weeks. And we'll be grading out that area so we can begin construction in early September. As it turns out, this summer, we're also renovating Jones Hall, our historic home, since 1927. About 15,000 square feet of space is being renovated in Jones Hall. And we're calling this Phase 3 construction, and it's relatively unsettling for our students who are here in summer school. This renovation project of Jones Hall is going to take our old library and convert it into 5 30-person classrooms. We're going to close the stairwell in the middle of the library, pour concrete. In fact, this coming Friday and Saturday, we'll be pouring concrete. Actually, it's a week from this Friday and Saturday. We'll be pouring concrete to cover that open stairwell between the first and second floor in the library and creating 2 separate floors. We're going to be adding biochemistry, genetics, physics laboratories, expanding study space, moving our faculty in our School of Arts and Sciences around the building. This construction is also going to be done by the start of school in August. So that in August we're going to have our new academic and research building and library and a fully renovated Jones Hall ready for our students in mid-August. This construction is also going to allow us, really for the first time in our history, to expand our research and do big-time research at St. Louis College of Pharmacy. This is going to allow us to partner with our neighbors to do big-time research. So I'm excited to announce tonight that the first occupants of the 6th floor of our new academic and research building will be the St. Louis Center for Clinical Pharmacology and Therapeutics. We have been working for 2.5 years with our colleagues at Washington University, Department of Anesthesiology, to jointly fund and create this research center. It's going to be a fantastic place. Both of us are making multi-million-dollar commitments to building the space and to hiring world-class faculty to conduct research there. We've signed the final memorandum of agreement. That was on March the 26th. And we are going to begin recruiting a director. In fact, our first candidate was here this past week to be the director of this research center. This historic partnership is the first one that Washington University has ever concluded with another educational partner for the purpose of developing a research center. It's also the first time we've done it as well. So we're very excited about what this means for our future and the new faculty that we'll be recruiting into this research center. We're also collaborating with Washington University and Goldfarb School of Nursing to establish a world-class center for interprofessional education. We are also in the final stages, Dean Canaday is, of negotiations to hire a new director of this center, this director will be located also in our new academic and research building, and will lead efforts to bring together our student pharmacists with medical students, OT students, PT students, and public health students from Washington University and nursing students from Goldfarb to learn and to practice together. We have another very short video that Dr. Gloria Grice, our Director of Experiential Programs and the lead on our interprofessional education programs, will discuss the importance of this interprofessional education, the center, and our goals for the center.
The Center for Interprofessional Education is a new initiative. We're really excited about it. It is a collaboration between 3 institutions, so St. Louis College of Pharmacy, WashU School of Medicine, and Goldfarb School of Nursing. So we think this is important because we're beginning to understand that how care is delivered is just as important as what care is delivered. Students are going to be learning 4 things. 1, how to value and do ethical interprofessional practice. 2, how to do teams and do teamwork well. 3, what the roles and responsibilities are for each of the members of their team, and 4, how to communicate effectively so that patient care isn't compromised. In addition to what they're going to be learning and how we're going to be training our students for the future workforce, we feel it's also important to educate the current workforce and maybe even do some retraining on how interprofessional practice is done with that group of learners as well. St. Louis College of Pharmacy has actually been doing interprofessional education for several years. The center is really just the next step in formalizing and expanding some of our initiatives. So primarily we're concerned with 3 goals. 1 is curriculum, 2 is helping to develop interprofessional practice models, and 3 would be research. In leading these initiatives, the role for the director of the Center for Interprofessional Education is going to be to coordinate a lot of these efforts and continue to expand upon them, but truly to build a new identity, one that is interprofessional between Washington University School of Medicine, Goldfarb School of Nursing, and St. Louis College of Pharmacy.
I think you know, those of you on our faculty who are here, Gloria is really a passionate leader and is a very, very talented person, and we're just delighted to have Gloria leading this effort. And I think she mentioned, really the importance of our student learning in teams and learning competencies of team-based and team-delivered care. But we need places in the community to practice this team-based care. And we have identified multiple local and international opportunities for our students to work with other health professionals in delivering this kind of care. We are in initial discussions with a dear friend and alumna of the college, Dr. Kendra Holmes, and others at Grace Hill Health Centers, recently renamed Affinia Healthcare, as well as other federally qualified health centers in the St. Louis region, to partner with them to get our students in those clinics much more extensively. In addition, 4 of our faculty members, one of whom is here tonight, provide care to underserved patient populations at the St. Louis County Department of Health in North County and South County clinics. Many of our students are committed to correcting health disparities in St. Louis, and we're proud of them. Danny Pratt and Faith Slayton are going to talk to you in just a few minutes about other things that our students are doing and volunteering in our communities to make a difference. And I think you'll see that Faith and Danny are tremendously talented people, and we're very, very proud of them. In addition to our local initiatives, the college is working diligently to improve patient care around the world through multiple international initiatives. Our Office of International Programs, as you know, led by Ken Schaefermeyer, are expanding opportunities for our students to be exposed to students from diverse backgrounds. We're also currently recruiting an Associate Director of International Programs to further expand these opportunities for our students. International service learning opportunities are provided to our pre-pharmacy students in places like Costa Rica, Guatemala, Poland, Romania, and we have a group of students right now in Macedonia, in the former Yugoslavia, who are working with patients there. In addition, we have advanced practice experiences for our 6th-year students in their last year in 15 different countries, including Bangladesh, China, Costa Rica, England, Ireland, Ghana, India, Israel, Mexico, Portugal, Saudi Arabia, Singapore, South Africa, and Swaziland. These kind of international experiences for our students are game changers for them, and it changes them forever. To bring all of these new initiatives to fruition, we're relying on our very strong academic and administrative leaders. We have 2 very talented deans, our Dean of Pharmacy and Dean of Arts and Sciences, who are helping us achieve this ambitious vision. Dr. Kim Kilgore serves as our Dean of School of Arts and Sciences. I don't think Kim is here tonight. I haven't seen her. And our new Dean of our School of Pharmacy, Dr. Bruce Candidate, who's right here. Bruce joined us in August, and so I had the same problem when I came as president. At some point you have to stop saying new, but it's not quite yet for Bruce, I don't think. I still introduce him as our new Dean of Pharmacy. A remarkably talented individual who all of you need to get to know. One of the leaders in pharmacy in this country and in the history of pharmacy in this country. In addition, we've recently hired a new Vice President for Finance and Chief Financial Officer at the college, Dr. Heather Flabiano. She'll officially be joining us on the 1st of June. She comes to us from St. Louis University, where she was Associate Dean for Business and Finance in the School of Public Health. Heather will be replacing Gary Torrance, who has served as our CFO for the past 17 years and has really provided incredible service to the college. In closing then, I want to thank all of you, our alumni, for the many ways you support the college, whether through your time, talent, or treasure, your commitments to scholarships, your commitments to our international and local initiatives, to our research and educational programs. Our continued success could not be possible without your time and talent and commitment. I think our future is very bright. And I think we are what Dennis Doyle said we were. We're a family. And on days like today, we've needed to be a family. I'd like to close with a video that Dr. Henry Manassi, an international leader in pharmacy and the chairman of my President's Advisory Council, brought to us at our sesquicentennial this year. Henry is an amazing transformational person, and I would ask you to listen to Henry's words.
The St. Louis College of Pharmacy is among the schools that is a leader in evolving the role of the profession through its curriculum, but also in being sensitive to always being on the edge, if you will. Not the bleeding edge, but at least on the edge of assessing where are things going in our healthcare system, where are things going in the technical scientific evolution of drugs and biologicals, vaccines, and all of that translates into strategic thinking. I've had the pleasure for the last several years to be a member of the President's Advisory Committee, and I've particularly enjoyed and appreciated working with Dr. John Pieper. I've been particularly impressed by his focus on strategic thinking, but also having a clear vision that aligns itself with progressive directions for the profession, for our sciences, and for pharmacy education.
With that, I will close my comments. Thank you all for coming and joining us tonight. Ask for your continued prayers for our community. And I think, Amy, do I turn this back over to you? I will tell you that I think next on our agenda are really the stars of our show here, as they always are, which is our students. We have amazing students here, and I think many of you know that. In fact, if all of our students could stand up, that would be great, who are here tonight.